There's so many different factors that go into why you go into medicine, and it's a long road, so it's something that you don't want to take lightly. There are people who start off the path because, well, that's kind of what I was supposed to do, or my dad was a doctor, and that's never going to get you through because there's so much commitment that goes into it. For me, there were a lot of different influences. The first spark that kind of pushed me in that direction was back in high school, and I'm local, so I'm from St. Pete, and I went to St. Petersburg High School, and it was my senior anatomy class where we were dissecting different animals, and I had a really great teacher that year, and was very kind of enthralled with how complex these simple systems were. Not even a human being, we did get into human beings, but even starting with the smaller life forms, and even we did a fetal pig dissection and learning the different anatomy and how much has to go right just to live and breathe and do the daily functions was amazing to me. And so that really motivated me to want to understand that and to help intervene when those processes don't go right. When something does go wrong, what can we do to try to get that balance back in order? Cardiology took a little longer before I decided exactly that I wanted to do that. That was not until residency. So I did my residency at University of South Florida, also local. And I remember one time I was in internal medicine, which is the beginning process before you decide to specialize. And I was an intern, and I had a patient in the emergency room. And this person had come in with a heart attack, and he was very critically ill, and he was in the emergency room, and I was evaluating him with the medical students. And he was up talking to me just like we are now, and in the middle of the conversation, his eyes rolled into the back of his head and he started to collapse. The alarm started going off. I looked at the monitor, and he was in an abnormal heart rhythm called ventricular fibrillation. And it was like straight out of the movies, like, you see on ER or other movies. They're calling for the crash card, and the adrenaline takes over, and you leap into action. And I was able to get the code cart, which has the shocking device called the defibrillator, and we were able to hook that up, and I was able to shock his heart, get him back into the normal heart rhythm, get him stabilized. We got him up to the cardiac catheterization lab and treated his heart attack with a stent to one of his arteries. And I'll never forget him wheeling out of there as soon as the procedure was done, looking up at me and was like, "Hey doc, how's it going?" And I mean, it was just like, I was floored. This guy was dead on the table just, an hour before, and just that process to bring him back just kind of boggled my mind. I was like, oh yeah, I want to be part of this. I still have a lot of that passion and drive, and that's one of the nice things about medicine. It's a constant learning process. So even younger guys in their career versus older guys in their career, we're constantly learning, because the medical field is changing so rapidly that you have to constantly be on your toes, and you have to constantly be learning new techniques and following the new research so that we can be on the cutting edge. And honestly, patients keep you on your toes nowadays more than ever. Back in the old days, whatever the doctor said was gospel, and that's not the case anymore. Patients are much better educated. They have access to resources, and they come with questions, and they come with really good insight into their health problems, and they're gonna hold you to task, and they're gonna ask you good questions, and you better be on top of your game and know what's going on. So yeah, I definitely still have that drive. The best part of my job is really the relationships you develop, and that's something that I didn't really get until I was in private practice, because when you're in training, you have little snippets of patients. You see more people in the hospital where you see them briefly. You have some clinics that kind of rotate, so you never really establish those long-term relationships, and so that's the big difference that I've seen in private practice. There are people that I've been seeing since I've been out for 7 years. I even had some people from training follow me over, and so to know patients for that long, you really get close with them. So it's not just about their medical problems, and you get to know their families, and they know my kids' names and ask me how things are doing, and they bring me pictures all the time of where they've been and their family. And so that's something that's really special that I really hadn't anticipated in the job from the training aspect. One of the focuses that I have as a physician is really preventative medicine. So I really like to focus on trying to keep people healthy long term. It's rewarding when someone has a problem and you can help improve it and get them better. But what's more rewarding really over the long term is prevention. You don't get as much bang for your buck at in the immediate sense, but long term, that goes back to having those patient relationships. When you see someone doing so well for years and not having a heart problem, that's better than having a heart issue and treating it. So I really like to focus on prevention. I also like to focus on compliance. We notice that people aren't always completely honest with their physicians, just because they don't like to disappoint people. And so if people aren't taking their medications or doing exactly what they're supposed to, sometimes they're not always forthcoming with it. So I like to really focus on that and talk to people about why we're doing whatever we're doing. So I think an older mentality was more, well, I tell you to take this medicine, you take it. I tell you to do this, you do it because I said so. And that doesn't really fly anymore, because people do have more questions about why and what am I doing this for. So I find that if you explain to people from the outset why you're taking this medication, why we're going to do this test, why we've got this treatment plan, they're much more inclined to comply with it, to follow it, because they know that they're actually helping themselves.